uploading on mnemonics. So in pharmacology, I have already discussed so many mnemonics, and since in succession to those videos on mnemonics, from now onwards, I'll be trying my level best to give you easy mnemonics for remembering certain conditions in medicine and surgery. So in general medicine and general surgery, most of the times you are asked in viva voce, whether it be the professional exams, writing part, or in viva voce, they ask you about the causes of tachycardia. So in this video, we'll be discussing about the easy mnemonics as to how we can very easily remember the causes of tachycardia in a very simple way. So it becomes very difficult when it comes to answering questions, whether it be the viva voce and your professor or the external examiner has come and straight away he says that enumerate the causes of tachycardia, or it can come as a short note in your professional exams, whether it be the MBBS, BDS, nursing. So when they ask you in a medicine question, general medicine paper, they can ask you very easily that enumerate the causes of tachycardia. So at that time it becomes very difficult and cumbersome to remember the causes in sequence. So here I have designed a very simple mnemonic as to how we can very easily pen down in sequence the mnemonic to write down the causes of tachycardia in a very simple way. So viewers, beginning with, so just to how to remember the mnemonic. So actually the mnemonic, what is there is you need to remember that the causes of tachycardia can be very easily penned down in sequence in professional exams if you just remember this statement that most patients do wish. Just by remembering this statement, that is most patients, M-O-S-T, most patients, P-T-S, most patients do, D-O, do, and W-I-S-H, wish. Just by remembering this, that most patients do wish, you can very easily pen down in sequence the causes of tachycardia in the professional exams very easily. So viewers, starting with, so the M of the most is referring to certain medications. So there are certain medications just such as salbutamol and atropine which can cause tachycardia. So the M of the most is referring to certain medications, that is salbutamol and atropine. The O of the most is referring to oxygen deprivation. So in conditions of oxygen deprivation also, there it can precipitate tachycardia. Apart from this, in conditions of stress or anxiety, so the S of the most is referring to the stress and anxiety, and in conditions of stress and anxiety, so the S of the most is referring to the stress and anxiety. So in situations of stress and anxiety, this tachycardia can be precipitated. And last but not the least, that is the T of the most is referring to trauma. So in situations, any kind of a trauma is there, the condition of tachycardia, it can be precipitated, that is increased heart rate above than 100 beats per minute. So just this was about the most. So these four M-O-S-T, every alphabet M-O-S-T is referring to one of the cause. Now moving on to the next important, that most patients. So P-T-S is referring to the patients. So do remember, viewers and students, the P, T and S, that is most patients. So every alphabet of P, T and S is referring to one of the cause. So the P of the patients is referring to pain. In situations of pain, the tachycardia can be precipitated. In conditions of thyroid, particularly the hyperthyroid conditions, tachycardia condition can be seen. And in conditions of sepsis, so any kind of an infection or in situations of sepsis, this tachycardia can be precipitated. So the most patients do wish. So for most patients do wish, just by remembering this mnemonic, we can very easily pen down in sequence the causes of tachycardia, and we can very easily answer in the professional exams, whether it be the viva voce or in the when it comes to writing in the professional exams. So MOST, most, PTS, patients, I have already discussed. Moving on to the next, that is do wish. So D and O, every alphabet is referring to one of the causes. So the D of the do is referring to dehydration, and the O of the do is referring to orthostatic hypertension. So the O is referring to the orthostatic hypotension. So this can also cause tachycardia. And last but not the least, that is do wish. So WISH is referring to one of the cause. So W of the wish is referring to withdrawal. So in certain patients, in certain individuals, when alcohol is withdrawn or certain medications are withdrawn, so in such situations tachycardia can be precipitated. So the W of the wish is referring to the withdrawal symptoms, and the I is referring to the infection. So in any situations of infection also, this tachycardia can be precipitated. The S of the wish is referring to the SNS system, that is the sympathetic nervous system activation. So whenever the body's sympathetic nervous system stimulation is there, so stimulation of the sympathetic nervous system is also going to cause tachycardia. So in such situations also tachycardia or increased heart rate can be precipitated. And the H of the wish is referring to hemorrhage. So in situations of hemorrhage also, this tachycardia can be precipitated. So students and viewers, this was a very short discussion where I have tried my level best to give you a very simple mnemonic for the causes of tachycardia just by remembering the line, that is, most patients do wish. MOST of most, patients, PTS of patients, DO do of the do, and WISH wish. So these all alphabets, every word of most patients do wish is referring to one of the causes of tachycardia. And just by remembering this mnemonic that most patients do wish, we can very easily pen down in sequence, and we can very easily enumerate even in the viva voce, in the professional exams, the causes of tachycardia in a very simple way. We can very easily pen down in sequence. So students and viewers, this was a very short discussion where I tried my level best to give you a very simple mnemonic just by remembering the statement most patients do wish, where every alphabet is referring to one of the causes of tachycardia. So you can very easily pen down in sequence in your exams. Students, if you like this video, give this video a thumbs up. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. And if you like this video, give this video a thumbs up and share amongst your friends. Thank you for watching.